Nurse Assistant Practice Test. Question 1. When providing care to a client with dementia, the nurse aide should: Option A. Maintain a consistent routine. Option B. Change the routine daily. Option C. Avoid eye contact. Option D. Speak quickly. The correct answer is option A. Maintain a consistent routine. A consistent routine provides structure and reduces confusion and anxiety. Changing the routine daily increases agitation. Avoidance of eye contact and speaking quickly are not therapeutic. Question 2. A client is grieving the loss of their spouse. The nurse aide should: Option A. Tell them to move on and focus on their health. Option B. Listen and acknowledge their loss. Option C. Avoid mentioning the spouse to prevent sadness. Option D. Suggest they should be grateful for the time they had. The correct answer is option B. Listen and acknowledge their loss. Listening and acknowledging the loss validates the client's grief. Telling them to move on or that they should be grateful dismisses their feelings. Avoiding the topic leaves them isolated. Question 3. Which precautions are used for clients with MRSA or VRE? Option A. Airborne precautions. Option B. Droplet precautions. Option C. Contact precautions. Option D. Standard precautions only. The correct answer is option C. Contact precautions. MRSA and VRE are spread by direct or indirect contact. Contact precautions require a gown and gloves for all client interactions. Airborne precautions are for TB and measles. Droplet precautions are for influenza and meningitis. Question 4. A client is in the active dying process. The nurse aide should: Option A. Avoid the client. Option B. Provide comfort measures. Option C. Stop all care. Option D. Leave the client alone. The correct answer is option B. Provide comfort measures. Comfort measures such as repositioning, mouth care, and emotional support are essential at the end of life. Avoiding or leaving the client alone is not appropriate. Stopping all care would be neglect. Question 5. When a client is being discharged, the nurse aide should: Option A. Assist with packing and ensure the client has their belongings. Option B. Tell the client to call if they need help. Option C. Let the client pack alone. Option D. Rush the client to leave. The correct answer is option A. Assist with packing and ensure the client has their belongings. The nurse aide helps ensure the client has all their belongings and assists with packing as needed, promoting a smooth, dignified discharge. Rushing is disrespectful. Question 6. What is the most important action a nurse aide can take to prevent the spread of infection? Option A. Wearing gloves at all times. Option B. Performing hand hygiene. Option C. Wearing a mask. Option D. Isolating all clients. The correct answer is option B. Performing hand hygiene. Hand hygiene is the single most effective measure to prevent healthcare-associated infections. Gloves, masks, and isolation are important but do not replace hand washing. Hand hygiene breaks the chain of infection at the most common transmission point. Question 7. The RACE acronym stands for: Option A. Rescue, Alarm, Contain, Extinguish. Option B. Run, Alert, Call, Evacuate. Option C. Rescue, Assess, Control, Evacuate. Option D. Remove, Alert, Contain, Extinguish. The correct answer is option A. Rescue, Alarm, Contain, Extinguish. RACE is the standard fire response protocol. Rescue clients in immediate danger. Alarm, pull the fire alarm/notify, contain the fire, close doors, and extinguish, if safe. Question 8. The compression to ventilation ratio for adult CPR, single rescuer, is: Option A. 15:2. Option B. 30:2. Option C. 5:1. Option D. 10:1. The correct answer is option B. 30:2. For adult CPR by a single rescuer, the ratio is 30 compressions to 2 breaths. This is the American Heart Association standard for effective CPR with minimal interruption. Question 9. The apical pulse is located at the option A, wrist, option B, neck, option C, apex of the heart, fifth intercostal space, midclavicular line, option D, elbow. The correct answer is option C, apex of the heart, fifth intercostal space, midclavicular line. The apical pulse is at the point of maximal impulse, PMI, the fifth intercostal space at the midclavicular line on the left chest. The wrist is radial, neck is carotid, elbow is brachial. The apical pulse is counted with a stethoscope. Question 10. A client with dementia is eating slowly and forgets to chew. The nurse aide should: option A, feed the client quickly. Option B, provide verbal cues to chew and swallow. Option C, puree all food. Option D, remove the food after 15 minutes. The correct answer is option B, provide verbal cues to chew and swallow. Verbal cues, example, chew your food, help the client eat safely. Rushing increases choking risk. Pureeing may be necessary for some but not all. Removing food after a short time may result in inadequate nutrition. Question 11. A client tells the nurse aide that they want to harm themselves. The aide should: option A, keep the information confidential. Option B, tell the client that they are being silly. Option C, report it to the nurse immediately. Option D, promise the client that everything will be fine. The correct answer is option C, report it to the nurse immediately. Statements of self-harm are mandatory reporting. The nurse aide has a legal and ethical duty to report this immediately. Confidentiality does not apply when there is a risk of harm. Question 12. A client with a pulse of 112 beats per minute is experiencing: option A, normal heart rate. Option B, bradycardia. Option C, tachycardia. Option D, arrhythmia. The correct answer is option C, tachycardia. A heart rate above 100 beats per minute in an adult is tachycardia. This is above the normal range of 60 to 100. Bradycardia is a rate below 60. Arrhythmia refers to irregular rhythm, not rate. Tachycardia may indicate fever, pain, dehydration, or other conditions requiring reporting. Question 13. A dying client requests to see their pastor. The nurse aide should: option A, tell the client the pastor is busy. Option B, contact the facility chaplain. Option C, change the subject. Option D, tell the client to pray alone. The correct answer is option B, contact the facility chaplain. Spiritual support is important at the end of life. The nurse aide should contact the chaplain or the client's clergy. Dismissing the request is inappropriate. Changing the subject avoids the client's needs. Question 14. The nurse aide finds a client's oxygen saturation is 88% on a pulse oximeter. The aide should: option A, document this as normal. Option B, report it to the nurse immediately. Option C, reposition the sensor and wait. Option D, increase the client's oxygen. The correct answer is option B, report it to the nurse immediately. Normal SpO2 is 95 to 100%. An 88% reading indicates significant hypoxemia requiring immediate intervention. CNAs cannot adjust oxygen, that is a nursing responsibility. While repositioning the sensor might be attempted briefly, reporting to the nurse is the priority. Question 15. The nurse aide should report which change in a client's vital signs? Option A, pulse increasing from 72 to 76. Option B, blood pressure increasing from 118/76 to 126/82. Option C, temperature increasing from 98.6 degrees Fahrenheit to 101.4 degrees Fahrenheit. Option D, respirations decreasing from 16 to 14. The correct answer is option C, temperature increasing from 98.6 degrees Fahrenheit to 101.4 degrees Fahrenheit. A temperature increase to 101.4 degrees Fahrenheit indicates fever and requires reporting. Minor variations in pulse, 72 to 76, blood pressure, 118/76 to 126/82, and respirations, 16 to 14, are within normal ranges and may not require immediate reporting unless accompanied by symptoms. Question 16. What should a nurse aide do if they experience a needle stick injury? Option A. Wash the area and report it immediately. Option B. Wait to see if symptoms develop. Option C. Apply pressure to the wound. Option D. Ignore it if no blood is visible. The correct answer is option A. Wash the area and report it immediately. Immediate washing reduces bloodborne pathogen transmission risk. Prompt reporting allows post-exposure prophylaxis if indicated. Ignoring any exposure is never acceptable and violates OSHA standards. Question 17. An adult client with a respiratory rate of 8 breaths per minute is experiencing Option A. Tachypnea. Option B. Bradypnea. Option C. Normal breathing. Option D. Hyperventilation. The correct answer is option B. Bradypnea. Bradypnea is an abnormally slow respiratory rate below 12 breaths per minute in adults. 8 breaths per minute is significantly below normal. This may indicate respiratory depression, sedation, or neurological impairment and requires reporting. Question 18. To prevent aspiration during feeding, the nurse aide should Option A. Feed the client lying down. Option B. Feed the client with their head tilted back. Option C. Feed the client in an upright position. Option D. Feed the client only pureed food. The correct answer is option C. Feed the client in an upright position. Upright positioning, Fowler's position, 45 to 90 degrees, allows gravity to help food move down and protects the airway from aspiration. Lying down or tilting the head back increases aspiration risk. Question 19. A client with dementia has incontinence. The nurse aide should Option A. Place the client in adult briefs without offering toileting. Option B. Offer toileting at regular intervals. Option C. Restrict fluids to reduce incontinence. Option D. Ignore the issue. The correct answer is option B. Offer toileting at regular intervals. Regular toileting maintains dignity and may prevent incontinence. Restricting fluids can cause dehydration. Ignoring the issue is neglect. Briefs may be necessary but should not replace toileting. Question 20. The nurse aide notes a reddened area on a client's sacrum that does not blanch, turn white, when pressed. The aide should Option A. Document it and turn the client. Option B. Massage the area to increase circulation. Option C. Apply heat to the area. Option D. Leave it alone. The correct answer is option A. Document it and turn the client. A non-blanchable reddened area is a stage 1 pressure ulcer requiring immediate documentation and repositioning. Massage is contraindicated. Heat is not indicated. Question 21. A client at risk for pressure ulcers should be repositioned how often? Option A. Every hour. Option B. Every 2 hours. Option C. Every 4 hours. Option D. Once a shift. The correct answer is option B. Every 2 hours. Clients at risk for pressure ulcers should be repositioned at least every 2 hours to relieve pressure on bony prominences. Repositioning every 4 hours or once a shift is insufficient. Question 22. The pulse deficit refers to the difference between Option A. Apical and radial pulses. Option B. Systolic and diastolic pressure. Option C. Radial and carotid pulses. Option D. Brachial and femoral pulses. The correct answer is option A. Apical and radial pulses. A pulse deficit is the difference between the apical pulse, counted with a stethoscope, and the radial pulse counted simultaneously. It indicates heartbeats not generating a palpable pulse at the periphery. Question 23. A client has had a stroke and has left-sided weakness. The nurse aide should Option A. Place items on the left side to encourage use. Option B. Place items on the right side where the client can reach them. Option C. Ignore the weakness. Option D. Restrain the left arm. The correct answer is option B. Place items on the right side where the client can reach them. Place items within reach on the stronger side to promote independence. Encouraging use of the weaker side is appropriate but should not be forced. Restraining is not appropriate. Question 24. When making an occupied bed, the nurse aide should: Option A, roll the client side to side, working with one side at a time. Option B, have the client sit in a chair. Option C, make the bed with the client on one side only. Option D, ask the nurse to help. The correct answer is option A. Roll the client side to side, working with one side at a time. Making an occupied bed involves rolling the client to one side while changing linens on the opposite side, then rolling to the other side. Having the client sit in a chair is for an unoccupied bed change. Question 25. If the nurse aide observes a change in a client's condition, the aide should: Option A, document it in the chart. Option B, report it to the nurse immediately. Option C, wait to see if it gets better. Option D, ask the client's family what to do. The correct answer is option B. Report it to the nurse immediately. Changes in a client's condition must be reported to the nurse immediately for assessment and intervention. Documentation can follow, but reporting is the priority. Waiting could allow a serious condition to worsen.